I welcome any venue and opportunity to have a platform to talk about this topic. This topic's been around a long time, but after George Floyd, there was this blow about we really need to use this tipping point to try to make a real difference. So we've had multiple tipping points in this country, to say let's embrace the fact that we are built on structural racism. Let's embrace it, acknowledge it, figure out how we got here, so we can move forward with no shame or blame, but to really make some changes in the lives of everybody we take care of. So this is a very uncomfortable topic for some people. It's an uncomfortable topic for me as well, because I do it every single day, but I am just as biased as everyone out there. So who in this audience is not biased? Raise your hand. Nobody. So we don't have a good model to follow, right? So we're all in this together, which means that we've all started this journey. We're all on this journey. It is not a sprint, it's a marathon. Take a deep breath. I'm going to go through some things that I hope that will help you be a little bit more comfortable with the topic, but I never want you to be comfortable. I want you to always feel like that you're okay to say ouch if you say something that's inappropriate, but to move on as colleagues and people who really want to make a difference in the lives of everybody. And so, of course, I wanted to talk to you about why we're here. So here's my agenda for the day. And the first thing is why. The second thing, we're going to talk about policies and practices, which you've heard a lot about already this morning, how important policy and decision-making at the government level makes a big difference in the lives of everyone. And then I think I can just stay away from this. Okay. We'll talk about what is diversity, equity, inclusion, so that we all are on the same page. We all understand what it is, and all of the people that we need to be concerned about, and that's all of us, by a government official who worked in DC and decided that we needed to think about how we talk about inclusion and how we work toward this whole aspect of how we include everyone. It always starts with us, and I'm going to go through that with you a little bit about what that means and how you can practice that in your own practice every single day. And then I'm going to talk to you about the 5 habits of inclusion and behaviors we need to practice all the time. We're not going to do a word cloud, because you can do that on your own, because we're not going to have time, of course. But when I do this exercise, I usually go through a word cloud and talk about what people think about inclusion. What does that mean to you? And that's something you have to define before you leave here today. Okay, let's talk about the why. So Olivia was a patient of mine, and she was diagnosed with HIV. She came in, she had HIV, and she was devastated. Young girl, pregnant, ready to get married. Also had poor health, bad dentition, and I took care of her from the very start of her diagnosis. So she was subjected to all of the stigma that you can imagine having HIV. She had multiple admissions in the hospital. In fact, she was diagnosed in the hospital because she went in full-blown AIDS and she was pregnant, and that's how I became involved with her. Olivia was a bright young woman. I say was because she's no longer with us. But she went through that journey of moving from AIDS to HIV positive, where she was able to function and do a lot of things and take care of her newborn child who was born without AIDS, without HIV. But she had a problem with the stigma that was around her. When she went to her own family's Thanksgiving celebration, she had to sit in a plastic chair and she had to eat out of paper plates. Think about the lack of knowledge and understanding of what the disease is in your own home. So she began to really shelter herself a little bit more, stay away from her family, really not be part of her community. Her and her significant other separated. She was by herself. So now think about this young woman who's trying to be the best she can be, raise a child in this country, and she had all the stigma of HIV, all the challenges you have around the social determinants of health, transportation, food insecurity. Secretary just mentioned that, right? All the things that she needed to actually just access health care. Thinking about those things is physical health care, mental health care, behavioral health care, and oral health care. And oral health care was at the bottom of her list. So she became healthier, although she was, of course, very immune compromised, and she wanted to now work. And she applied for a job at one of the local stores, and they told her they wouldn't hire her. And you know why they wouldn't hire her, right? Because that's why I'm here. They wouldn't hire her because she just didn't look great. She wasn't appealing to the public because she had really bad dentition. So, and we talked about that for a while, and finally we got her help. And finally, she had all of her teeth removed, and she had dentures. And she was beautiful. I thought she was a beautiful soul before she even had that work done. But she saw herself as this very productive individual now who could go out and get a job and make a difference in the lives of her family, lives of her community, and lives of her child, life of her child. And she got a job, and she worked. And I saw this young woman go from this devastating diagnosis of having AIDS to this very, very productive individual who was happy, full of joy, who's taking care of her child. And it was the total health picture. It was everything that we gave her, from mental, physical wellness, and social wellness, because you think about who's around you, who's supporting you, who's really making sure that they care about you. Olivia passed. She went in, she was full-blown AIDS again. She didn't come out the ICU. But I remember how joyful she was when she got that first job that someone denied her when she first applied because of her oral health had improved. This is important for us to talk about from the standpoint of this, thinking about Olivia and the challenges she had around equity, equality, inclusion, and why we need to think about it every single day as we take care of our patients and become partners with our patients or our clients or whoever we're working with. So we know, based on diversity, equity, inclusion, and the value, and in diversity, equity, inclusion is a value differentiator for you if you don't know. And if you look at any of the studies done, Harvard Business Report, Deloitte, everything that they've studied says that you get a 75% increase in your engagement with your employees, 30% increase in market share if you include DE&I as part of who you are in your fabric. So we know the why from a business standpoint, but the why from your individual standpoint is, what is your why? Why do you think you need to belong in this space of diversity, equity, inclusion? Better colleague relationships, better engagement with your employees, less absenteeism. It goes on and on and on. If you find a place where people can come to you authentically and do the job they need to do. So we're going to talk about that a little bit, and hopefully by the time you leave here this morning, well, how I leave here this morning, you'll have a better understanding of where you need to go. And remember what I just said, it all starts with each individual one of us, because we're all biased, right? So I love to tell stories, and I could tell you a lot of stories about my biased behavior. And because I do this every single day, I have to apologize all the time, because I do say things that are inappropriate, just like we all do. But I'm going to ask you a question before I move on. How many of you believe you belong to a diverse community, in a diverse environment? Who raised your hand? Who belongs to a diverse community? Nice. Okay. So but maybe about 15 hands went up, and about 30% of those individual hands that went up were white people. Now, why do white people think you don't have to belong to a diverse community? I don't understand why you... First of all, did we not all come over here on some boat at some time? Did we not? Okay. You're not going to tell me that you're living in communities where you don't have people who've come from all over this world living with you. So you are already in a diverse community. And it's about understanding that and really making sure you can talk about that in a way that's comfortable for the people that you live with. So we all come from a diverse community. Community is defined very differently these days, right? And so I'm going to tell you why I start with this issue of community. Because I am a senior vice president. I'm in the C-suite all the time. And we were sitting around talking about what we don't have. We don't have nurses. We don't have doctors. We need a neurosurgeon. We need environmental service workers. We need. And so, as many times as many of you who are look like me end up in a room, you're the only one, right? And the senior person said to me, Margaret, I want you to go to your community, talk to your churches, and tell your community that we are hiring, and guess what he said? Where would be hiring? In the hospital. We are hiring in the environmental service department. He didn't say we needed a neurosurgeon. He didn't say we needed nurses. He said to me, we need someone in the environmental service department. So how many macroaggressions do you think he did in that very short period of time? His assumption that I lived in a community that looked like me, that I went to a church, they all looked like me, right? And that because environmental service was where we see a lot of people who look like me, that I could make that happen. Now, how I responded to that is what's important. Because how you respond to those types of microaggressions, and whether you're black, white, matter, you've had microaggressions that you probably didn't think about, but you've been there before. People have said things to you, and you're like, where did that come from? So I wrote this wonderful letter. After I left the room, of course, I left the room, I said, where would you like me to send them to if they're interested, right? So now I said that outwardly, but inside I was saying so many four-letter words you couldn't imagine, all right? And I'm a sailor, so I can cuss. So I served. And so I left. I went and talked to my husband, and he listened to me as usual as he was talking me off the ledge. And I wrote the letter. And I wrote this beautiful letter about, coming into our system and having an opportunity to have a view of this big organization where you can become anything you want to become in this healthcare system. And I sent that letter out to every synagogue, every church, every Baptist church. I sent it all over the place, right? And then I sent it to him. And I said, this is a letter that I sent as per your request. And here's who I sent it to. And I said, and I'm sure that you will get a lot more applications because this is a broader pool to actually pull from. What do you think his response was? Believe it or not, he called me and apologized. Can you imagine? Now, can you imagine what would happen if I went off in that room at that time? Okay, but I didn't. So anyway, so the why is that this is important. I'm part of Highmark. I've only been there for 3 years. I've been working in diversity and inclusion for about 30 years. But they hired me there because they intentionally have invested in making sure that system, the healthcare system, really has diversity and inclusion as part of their fabric. So let's talk a little bit about dentistry. You know more of this than I do. Hey, how are you?
I'm good.
Good. I know one person in the room. So you know this data already. You know the difference between how black men and black women actually present for dental care. You know what happens to Hispanics as well when you compare to white individuals who actually present for dental health. And what does that mean? That means that you're going to find both, and the other one about males versus females, unbelievable, who really seeks out dental care and why they do not. Now, I was born in the era where, if I had a tooth that was loose, what happened to me. I get put that little string around and put it on the door, and that's how I get rid of it. But dentistry has always been a very fascinating art and fascinating science. And it's one that we have ignored too long in our medical professions. So another one, this talks about black adults and Hispanics and how basically the same thing. People have never even gone to the dentist. Like the statement there says, blacks and Hispanics reported they have never been to the dentist at more than 3 times the rate of white respondents, right? And why do you think that is? Multiple reasons why. Social determinants of health is one issue, but the other one is why do they not think it's so important to them? They take care of every part of their bodies, right? But there's something that they don't focus on, is their dental care, because it's not a priority, but it should be. And so this is dental schools. I wanted to, because I am a professor and I love to teach all the time. I still see patients, I still take care of residents and teach students. And so I'm always interested about schools and what's happening. So in your dental schools, actually doing this is a really good picture that you have done a significant improvement in the cultural makeup of your dental schools. And so 2 things though. Latino and blacks have stayed the same, but that's better than what's happened in the medical schools, because it's absolutely horrible. It's significantly decreased when you talk about race and ethnicities. And of course, the percentage of women have enrolled in all schools have been increased, you know. And as you know, women, that's a really positive thing, because that wouldn't have happened until we became significant advocates for women's care. So this was just an example I wanted to show you in your space. All right, now let's talk about the impacts beyond the mouth. You already know this information. However, I wanted to review it because, you know, I take care of women, and I take care of women who are obese, who have hypertension, who age and now they have Alzheimer's. And when I looked at this and I thought, oh my goodness, to think about the impact good dental care could make on all these individuals if they had the opportunity to invest in it. And how do we do that? And the most important one on there for me is the last one, because the last one talks about women who go into preterm labor, have preeclampsia. And you know that, according in Pennsylvania and many other states, that black women have the highest rate of death in pregnancy, and black babies die 3 times more than white babies in Pennsylvania. All right? I'm in that movement. I have programs that's focused on that. But to think about the significance of dental care and what it can do to people's lives is unbelievable. Just a quick slide. You've already heard a lot from your politicians, from people who work in the government. Political determinants of health result in the social determinants of life. We have paid attention. If you have not, you need to start paying attention. For years, if you've a book called 100 Years of Obamacare, it's how we change our medical care over the years, if you haven't read the book. Daniel Dawes wrote it, and it was how we got up to affordable care, the Affordable Care Act. Phenomenally how in the space of legislation, we have dictated what can happen to us in our lives based on what we pay for, what we don't pay for, what we're doing in various states. We can continue to say that we are United States, and if you believe that, you haven't been paying attention, right? So there's a lot of things that have happened in the political arena that we need to understand so that we can take care of our patients better. Because we interpret that, start practices in our own environments that sometimes does not appreciate the fact that we have things that raise their ugly head, like sexism, racism, management that we give people living with disabilities or don't give, right? Veterans, our LGBT population, many of what I call the minoritized populations. And so just keep in mind that we have to really be advocates at the level to change policies and procedures as well. In our system at Highmark, when they hired me to say, what can you do to make sure that we are practicing good health, that we are really thinking about social justice, all the things that we do. And so we took a really good stab at some of our policies. And we're looking at every single policy we have to say, does this policy reflect good patient care? Does this policy reflect social justice and equity? And you believe it or not, how many we found that didn't. That, you know, we had written things that just didn't make sense when you're talking about taking care of everyone. Based on many of these policies, we came up with a policy called Refusal of Care Act, which means that any patient who comes into our system cannot refuse care from the team based on their characteristics. They're wearing a hijab, they're a white male, they're a black female. The patient then, we have an algorithm, so the patient is discussed with the patient about the fact that we don't tolerate that at all, and the patient has the right to leave and go to another facility, right? And so it's a Refusal of Care Act, meaning that we're going to protect us, the caregivers who work every single day trying to give the best care that we can. And that came out of looking at the policies and saying, how are we protecting our patients, but how are we protecting ourselves as caregivers every single day? This is the Institute's principles. And I say the Institute's principles because when I came to Highmark, they said, this is one of our priorities. We have 10 priorities, and D&I is going to be one of them. And based on that, we established an institute, which is well-funded, which is across the system, and which we want to make sure it's sustainable. Because when I leave, we don't want programs to leave. When I leave, we want to make sure that these are not just one-off programs, that this is a continuous effort along the journey of becoming a model in diversity, equity, and inclusion. So these are the Institute principles that we talk about. Collaborating, I mean, very simple. You know, reach out, get out of your comfort zone, start collaborating with people that you hadn't thought about collaborating with. Having conversations with folks around dental care and what they're doing in their offices and what they're doing in their practices makes a really big difference about how you think about giving care and giving care better. But bring up the topic of equity and inclusion. Advocacy, we talked about a lot already today, how you become an advocate. And then how do we create dialogue around the structures of inequality? And that means you have to physically, so whoever's in charge of your practices or what are you doing, have to physically engage in someone coming in to say, let's talk about this. You know, let's have some guidance in this on a regular basis. And then as far as increasing access to educational research and professional opportunities, the Secretary talked about data, and I think you talked about data a lot this morning.